Thank you, Denise. Y'all been very kind to have us and let us do talks, and so this is very familiar to be here for me. Some of y'all have heard some version of this talk before, so we're mixing it up a little bit. I think in the past I've talked a lot about customized knee replacement, which has been a big deal in my practice. We're going to throw in a couple of more things today just to give that some additional information for any of you that may have interest. And as she said, I'm open to questions, and that's probably the best part, is any of this information can be a jumping off place for us to discuss anything relative to hip or knee surgery that I can help you with. A bunch of stuff. There's my email. If y'all want to reach out, we have a website. You can find me on pretty much any social media platform, Facebook, Instagram, LinkedIn, all of those if you'd like to connect with us. We're going to talk today about custom knee implants, about a system called My Knee, which I've not talked about before in this kind of format, and a little bit about robotics for joint replacement surgery, all of which I think of as a more personalized approach to your surgical treatment with any of those. My disclosures, I have done some lab teaching for customized implants with other surgeons and things like that. I don't have any royalties. I didn't invent any of this stuff. So the first one that we're talking about, what Denise has is a conformis. I guess if I'm 6 feet, I can do that. Fully, can you hear me now? Do I need to repeat all the first part? Is a customized implant made with 3D printing technology. So each one of these implants is completely unique. It only fits one person in the world. What comes in that system is this customized implant that's size and shape matched to each patient. So if you see the slide on the left of those pictures, that's what they look like. There are some slightly different tweaked versions of these that are available, but you see these different shapes and you see these different sizes. I've put in like 600 or 700 of these now, and you really do see that kind of variation in terms of the shape. What gets overlooked in this, that's also an important part of this system, is these guides that come with it on the right side of the screen. All of these are 3D printed disposable guides that we use in surgery that actually help me to shape the bone to fit these implants. We think of it as pre-navigated, whereas in other systems we might use computer navigation or robotics to map the anatomy and to correlate things with that. These sort of come pre-packaged. So what we're doing here, instead of making the implant fit our patient, instead of making our patient fit the implant that we have, we're actually making an implant to fit that particular patient. That's a multi-step process. It starts with a CT scan. Takes about 6 weeks after that to have everything produced and get ready for surgery. We use that time typically any medical clearances that are needed. I'm a big advocate for preoperative physical therapy. Even if you go just a couple of times, get walked through what you need to be doing before and after surgery to strengthen and to improve your range of motion. Kind of a schematic of how some of those customized guides look. As a patient, you'll never see this part, but this is part of, not all of it, the roadmap that I get in surgery. It's called an eye view for this system. It shows those customized guides, and if you see those little red and black numbers, you can see to the 1/10 of a millimeter how much bone I'm going to be removing. If that patient had 5 degrees of tibial slope, I can reproduce that. If they had 8, 7, whatever it was, we can take you back there. There are some curbs built in to restore a relatively normal alignment and normal contours of the bone. And that's it, a knee in a box. The whole system, about like that. All of those 3D printed guides, the custom implant, everything you need for that surgery, short of a few retractors, comes packed sterile in that box. In that list of barcodes, it has the surgeon name, but it also has my name on it, and it only fits one patient in the world. Some of these slides I know some of y'all have seen. This is available in a partial knee replacement system. Not everybody needs a complete knee replacement. For people with arthritis in just one particular part of the knee, this can be a great option. Just a schematic there to kind of show you the difference. If the right is a total knee replacement, the left is a partial. We're just resurfacing a portion of the joint. And for a lot of patients, when they hear total knee replacement, they really think, I'm going to lose about this much of my leg on the inside and a giant hinge is going in that replaces all of that. Really what we're doing is resurfacing that joint. So we're taking away 8-9 millimeters of surface where cartilage is worn away and where some of the bone is diseased, and we're resurfacing that. Cool technology. Why the heck would we do this? It's a lot to go through just for something that sounds neat. Well, we want to improve outcomes. If we can make surgery better, if we can make recovery faster for our patients, we want to do that. The other thing is we want to lessen dissatisfaction, which sounds like improving outcomes, but really what we know is that there's some percentage of knee replacements, 10, 15, maybe even 20%, depending on what studies you read, where everything went well. Patient didn't have an out-and-out complication. There was no infection. Their implant didn't come loose. But they still have pain. It feels unnatural. Their surgeon says their x-ray looks okay. They can walk. They can move their knee. But it's just not what they wanted. They're just not happy with it. So we spend a lot of time thinking about and trying to help those patients. And this system is geared toward a lot of the things that we think can make that better. So things that we know that can cause pain, implants that don't fit right. If there's a size that's too large, like you see on the bottom part, it can rub against soft tissues and cause irritation, especially if that's 3 millimeters or more, according to some of the studies that we have. The top situation, you can see where the bone has been cut to accept that implant, and there's a lot of cut bone that's uncovered. So that's almost an implant too small situation or a bone that's uncovered. Well, that bone can bleed into the area, can cause swelling. That probably doesn't affect a lot of things long term, but it can affect blood loss with the surgical event. And it can slow down recovery if it causes a lot of swelling. And we do have some evidence for that. This is a schematic of the same type thing, just showing the difference between a customized implant, like you see on the right, and a conventional implant, or the company loves to call them an off-the-shelf implant. I mean, conventional implants are still good. This is kind of a marketing tagline, if you will, but there is a distinction and a difference between the two, and you really can see that surgically. So Dr. Will Kurtz in Nashville, really smart guy. He did this study demonstrating that those implants, like we showed, actually took away a little less bone than a conventional total knee replacement, so you're saving more of the patient's own bone. And they did have less blood loss and swelling after surgery. The fit, the shape and contour of the patient's normal knee, those are those goals that we talked about that can cause pain that we're trying to address with this customized system. As much as the size, the shape matters. Everybody's knee has a little different radius of curvature where your ligaments are. Your femur has separate medial and lateral curves to it, and this system replicates those. We're still studying, we're still trying to find out how much that matters, how much that influences the final outcomes, but intuitively, we're trying to match something that's closer to your knee. Here's one study, lots of graphics and words, condylar liftoff, laxity. Basically, in this study, these customized implants behaved more like a normal knee. Some studies here with increased functional activity, in other words, they were faster to get back to normal things like walking, stair climbing, what are called timed up and go tests, and patients were more likely to have a good or excellent knee society score than they were with a conventional implant. So switching over now from a fully customized knee implant, because that was what I've talked about before when I've gotten here, and this has been something that's been a little more, not a little more, but a little interesting to me in my practice over the last year, because I had a lot of patients that were very interested in customized knee replacement, but they had old hardware from previous surgery. They had really bad osteoporosis. They had really bad deformity where their knee was bowed one way or the other. Some things that made them not great candidates for custom replacement because they needed a conventional system that had modularity. In other words, lots of different sizes of plastics to go in it, the ability to add metal augments to a prosthesis or add stems or things like that. Well, this is a product called MyKnee. It's from a Swiss company called Medacta. I think of it as a hybrid system between the two. So this uses some conventional implants, conventional in the sense that they're in a range of pre-made sizes. So, 1 through whatever and 4+ and a lot of different sizing options, but they're pre-made in those sizes. But it takes advantage of that same concept of a CT scan and 3-dimensional planning of each patient's anatomy. So if you see this screen sort of on this fake iPad here on the right, that actually shows up in a program. So I get that even before we start making these custom instruments, and it shows me what size the patient should have, what size the engineers think they should have, where it should be oriented, and how everything should fit together. Well then, and this is even a little different than the customized implants, I get to adjust that plan. So I can see that 3-dimensionally, I can spin it around, I can change sizes up and down, I can tilt things a few degrees and see what fits best, and I get the luxury of doing that all, from my desk and not trying to figure it out during surgery. So then when we get it like we love it, they produce the system and I get these 3D printed guides that determine where the bone cuts, the bone resections are during surgery and help us place these implants. So it's particularly useful, and this is a case I did a few months ago. I don't know how much you can see or how much you're used to looking at stuff like this, but if you look to the far left, this femur is not straight. This is someone who had a fracture many years ago, treated in traction as they did at the time, so there's still pretty substantial deformity. That is very difficult to address with conventional instruments during surgery. Computer navigation, CT scan planning, some things like that can help make that better. Difficult to do with a custom implant system because it may work great, it may not, but you don't really know until you get in there, and then you don't have those fallback options of the modular parts. So in this case, we did this MyKnee system. You can see implants in over here on the left, perfect fit with that, restored the alignment of the extremity, taking into account what had gone on already in this patient's femur years before.
So it made that bone straighter?
No.
Did I look at that wrong?
It made the leg straighter.
Okay.
So you've got a bone up here that has a fixed deformity in it from where that fracture is healed, and a leg that's very bowed inward. And in this case, we actually use the orientation of the knee to align that
Oh, I see.
and get the extremity corrected. So if before you were looking at a leg that may be more like that, now it looks straight and he stands straight when you have that. But I've got a whole range of implants, and if I get into the surgery and decide, okay, this is great, I've got the leg straight, but it's not stable at the knee, I can add thicker plastics. I can add, this even actually converts to a revision system that has more constraint between the implants, and you've got sort of some pivots that can happen in real time versus if I just had a custom implant, it may work and it may work great. If it doesn't, well, now all of a sudden I've got to change to a whole different system during the case and figure out how I'm gonna get this alignment right, and we're back to sort of eyeballing some things, which, I mean, we as surgeons have done that for years. It's possible, but I would love to be as accurate as I can and try to make this perfect.
I didn't mean to interrupt.
I'd look, I want to know what you're thinking and what your questions are. This is another fairly recent case, and so the staple there at the bottom was from an old bony procedure many years ago. I'm not always sure what that bone's going to be like in the tibia. This slide on the left is pre-surgery, so they're showing me where that staple is and that I should have minimal interference because they're showing me exactly where my implant's going to go. So I know that ahead of time, I can plan for it. And in this case, because of the changes in that bone, this stem is actually modular and adds on to this implant. I can put that on during surgery. I can make it longer if I feel like I need to based on what I'm seeing in the OR. So it's the benefits of customization with a lot of flexibility in the OR for things that may be a little more difficult. Let's see if this will. This is, I don't know, I try to do some of the videos. This is Tom. He had that My Knee system. It's with what's called a medial pivot implant. That's 2 weeks after surgery. I mean, he's got a little bit of a limp, but for a knee replacement, 2 weeks later, no walking aids. He's doing great. Oh, there we go. That was the button I needed to hit. So the other step, and this comes up in a lot of these conversations, is robotic surgery, and where does that fit into this? We do this as well. We were one of the first hospitals in the area, coming up on almost 4 years ago now, that started doing robotic total knee replacement. Quite honestly, for a lot of reasons, maybe beyond the scope of this talk, I use this system more for hips and for partial knees. I do like the customization of custom implants and that other hybrid system with doing total knee replacements. But robotics is another way that we can be accurate and that we can be personalized with surgery. When we think about joint replacements, we don't want to damage vital structures on our patients. We want to keep as much bone and healthy tissue as we can, and getting those implants in a really great position helps with function and helps with longevity of those implants. And robotics are good at helping with that just because they can be very accurate. So particularly if we're talking about hip replacement, and I've got a picture of knee up here as well, but if you look at this slide on the right, this is historically what we've used to put the socket part of a hip replacement in. And if that looks like a metal rod with some other metal rods on it to help orient it, that's because it's exactly what it is. So you're looking at surgeon judgment and experience, their knowledge of the anatomy and the landmarks, and most of us have not used them a lot, but these little so-called whirlybird systems where you were intended to look at this and make part of it level to the floor, and especially with a patient laying on their side, is this 20 degrees, is this 20 degrees, is this too much? There was a fair amount of guesswork in that could be affected by how the patient was positioned on the table, by the patient's size, a lot of other factors like that. So this kind of system lets us be extremely accurate because we're, again, planning it three-dimensionally based on a CT scan. Size of the implants, this one gets a little busy, but if you see the green, that's where the hip socket is going. 40 degrees one plane, 20 degrees the other, and it can be different depending on the surgery, obviously, but you're planning all of that ahead of time. You know exactly what size socket that patient needs, what fits their bone best. So it really is personalized to them, and then we're using that robotic arm to actually be very accurate in how we do that during the surgery. This is one of my cases doing that, and again, if you're not looking at x-rays a lot, this could get busy, but this is actually not an x-ray of the patient post-op. This is actually part of the planning in the system. So I can see exactly what my final implants will look like in terms of size and position, and very importantly, what the leg length is here. So I love these zeros. That's in millimeters. That means I'm dead on in the leg length versus the other side, because that's one of the risks historically that we've had with hip replacement surgeries is differences in leg length. Now, if it's very small, you probably won't notice it. Most patients are super grateful that their hip feels better, and it's not a big deal. If that gets to be longer, it can be really annoying. You have to have shoe lifts, a lot of other things that go along with that. So this is something that we can plan and then measure in the OR and try to be more accurate with. So some frequently asked questions really with a lot of these systems. There's not an increased cost. No, we did talk about you do have to do the CT scan, so sometimes insurance is pushed back a little bit on those, and we have some workarounds for that. But we can get these technologies involved and make this part of your procedure, and there's some ways to do that. Is this for everyone? Well, you know, this was a slide that I used in that custom knee implant talk, and I would have to say no, it's not, but available for a lot of people. Well, some of these things, these large deformities, previous bone loss, things like that, now with the MyKnee system and even some of these robotic technologies, we do have options for that as well. For patients that won't wait or can't wait, there is a little bit of lead time associated with the CT scans and with some of these custom technologies when anything's got to be made. So you'll have a little lead time, but most people can factor that into their surgery. Again, talking about custom implants, certainly every evidence that those should last a long time. Same materials as conventional implants, those industry standard materials. We're waiting on real data on a lot of these things. There's the theory that some of these are going to have a quicker recovery. And certainly like the gentleman you saw, you know, a couple weeks after surgery, that's not everybody, but seems to be getting more common. And I think that when we're accurate, when we have a knee that moves and feels like somebody's own knee, that we have a better chance of getting there. There are some studies that indicate that custom implants may provide a quicker recovery. Those are also, you know, those studies have involved surgeons that are designers and are consultants to the company that makes them. So I kind of take that with a grain of salt, but we're getting some evidence for that. And that's it. I mean, you can, like I said, you can reach us via email, via social media, however you'd like to connect with us. But I do think that overall we're moving into this era of much more personalized orthopedic care, particularly for joint replacement, where we are leveraging some of these technologies. You know, we've over time evolved from implants that were small, medium, and large to now we've got a full range of sizes. We've got custom implants available. We've got three-dimensional planning to really show us what we're doing and where we're going. It's not that we couldn't do it before or that it was particularly bad, but it really ups the level of personalization with this. I do hundreds of joint replacements a year, but I've never done your right knee or your left knee before.
Right.
So to have that roadmap, to have that CT scan, that three-dimensional planning is true north. I mean, it gives me okay, this is what's really going on here. This is what we can do, and just adds a level of precision and accuracy to that we think is going to carry through and get us better results, hopefully both short and long term with that. So.